This is a slightly edited version of a brown bag presentation made at the ADB headquarters in Manila on June 17, 2015. What is digital health infrastructure and why should we invest in it? My name is Derek Ritz. Here's an overview of what the presentation is going to be today. First of all, what is digital health infrastructure? And how does e-health impact upon population health? Then we'll look at why is a digital health infrastructure a strategic investment for the bank, and why now? So, what is digital health infrastructure? We'll use a story to help illustrate our definition. This story is about a migrant worker named Ramesh. Ramesh's story has 3 chapters. Ramesh is feeling unwell. His malaria-like symptoms are noted by a community health worker in the village where he's staying. Following advice, Ramesh attends a community clinic to have a rapid diagnostic test, or RDT. Based on the results of the RDT, Ramesh seeks treatment at a district health center where he receives anti-malarial medicines. The community health worker in Act 1 of our story employed an mHealth application. The SMS messages were saved into the mHealth system's database. At the local clinic, the nurse used a basic electronic medical record system, or EMR, to log the results of Ramesh's rapid diagnostic test. When Ramesh saw the doctor at the district clinic and was prescribed his course of antimalarials, the information about his case was saved to the database of an MOH-hosted system dedicated to malaria care. None of these databases are connected to each other. Ramesh's information is trapped in separate information silos. And this is the problem that digital health infrastructure solves. It is a cloud-based health information sharing service that connects the silos and supports coordinated service delivery, two-way information flow, and continuity of care for Ramesh over time and across different care delivery sites. An example of such a digital health infrastructure service is the donor-funded, standards-based, open-source health information exchange, OpenHIE. You can find out more about OpenHIE at their website, www.ohie.org. But why should we care? How does digital health infrastructure impact upon population health? This diagram illustrates a process control-based model for how digital health infrastructure impacts upon health. Let's follow the arrows step by step. Firstly, we see that health interventions yield population health. The role of our mHealth and eHealth systems is to operationalize our health interventions. Digital health infrastructure is an industrial engineering intervention. Its job is to help us be better, more efficient, and more effective at executing our health interventions. When we leverage digital health at the point of care delivery, we generate person-centric transactional data. Here is where the importance of our eHealth standards is driven home. If we lay down our transactions in a computable format, we can aggregate them to generate population-level metrics. We can aggregate at whatever level we want. Data summarized about our subject of care, by definition, is a longitudinal health record for that person. We can aggregate at the provider level to support human resource management and payment schemes like performance-based financing, or PBF. If we aggregate at the facility level or the district level, we can support health system planning and management. And data aggregated on a national basis can be used to develop population-level metrics and reportable indicators. Importantly, our metrics can be used to inform our eHealth systems and the health interventions they support. This creates feedback loops. It affords us a way to exert process control and continuous quality improvement. How does this process control work? First, the Ministry of Health's Standard Operating Procedures, or SOPs, are operationalized by the digital health infrastructure. Within the care delivery network itself, The digital health infrastructure supports continuity of person-centric care. The transactional data generated by care activities can be compared to the SOPs. This comparison provides important health system management metrics. Aggregated indicators can be developed from the person-centric transactional data, and these can inform modifications to the SOPs. When these new SOPs are operationalized by our eHealth system, the continuous improvement cycle starts again. Let's talk strategy. Why should ADB invest in digital health infrastructure? One quite compelling reason is that it is part of the bank's operational plan to do so. Digital health infrastructure is, well, infrastructure, and it is infrastructure that provides the foundation for taking promising care innovations and technology innovations to national scale where they can deliver real impact. Digital health infrastructure, if we invest smartly, supports progress across a broad range of related initiatives. This topic was the subject of an e-book released in 2014 by the Joint Learning Network of Universal Health Coverage. This e-book can be found at jln1.pressbooks.com. As a health-related example, present elimination strategies rely on person-centric, case-based surveillance. Rolling out such a capability will require countries to move to at least a medium maturity level of digital health implementation. Beyond pure health initiatives, common, shared infrastructure can be leveraged by multiple applications supporting user communities across the 4 Ps: patients, providers, policymakers, and payors. This means smart investments in digital health infrastructure also support companion initiatives such as universal health coverage, unique citizen IDs, and civil registration and vital statistics, or CRVS. Importantly, ADB is also well served by prudent investments in the establishment of a regional interoperability lab under the auspices of the Asia eHealth Information Network, AHIN. In the same way that such labs have proved invaluable to supporting initiatives in North America and in Southern Africa, the AHIN lab will play an important role here in the Asia-Pacific region. The lab mitigates investment risk and supports capacity building in health ICT. As a center of eHealth excellence, the lab will also support the development and productization of new digital health innovations. Its role will include the 4 Ts: teaming, training, the development and release of open source tooling, and finally, system conformance and load testing. Now is the right time for ADB to move forward with smart digital health infrastructure investments. It'll improve developing member countries' ability to execute their health production functions, support key strategic objectives such as UHC and CRVS, unlock value that's presently trapped in existing M and eHealth silos, and mitigate investment risk by supporting a regional public good, the Interoperability Lab. Thank you for listening to this presentation.